My name is Emily, and today we'll be talking about justice for elderly veteran choice and the Elizabeth Dole Care Act, which is assisting with that. Keep in mind that we will all be old one day, and we need to eliminate ageism. We need to preserve their voice. The problem I am addressing today is that elders are being forced into assisted living locations rather than being able to age in place as they would prefer. This is especially true for veterans who have given so much for our country and still have to face this issue. Benefits in aging in place. Some include older adults already having a sense of identity there. They have all of their items. They know the area. They know resources. They have neighbors, pets, friends, and there is more cost effectiveness and choice with aging in place. There's a less chance of them getting sick as well. The aging population is increasing exponentially, as we know, and will be about 80 million by 2030. On the left, we have a study here that shows the best way for independent living for elders. SWOT analysis looks at strengths and weaknesses of elders in their environment and addressing those. We have cognitive training, such as brain games, self-management programs, which look at decision-making and resource utilization, among other things. Empowerment. We have training for physical needs, such as exercise in general, water aerobics, evaluation of activities of daily living, such as hygiene and functional ability. EPRZ is effective with this because EPRZ acknowledges that elders are susceptible to diseases and various other functional disabilities. They take secondary and tertiary measures to make sure that that does not get any worse. Age-friendly home environments are a must with roll-in showers and grab bars. We want an age-friendly city that empowers the elder and allows for resource access and just promote autonomy wherever possible, especially family interaction. Current social issues impacting our ability to achieve this goal include social stigma and ageism. Again, people do not realize that they're going to be old one day. Veterans are susceptible to nursing home abuse. They are high risk for cognitive impairment, social isolation, physical disabilities, and mental health issues. All of these factors contribute to nursing home abuse and the likelihood that that abuse will not be reported. Another issue is Medicare and Medicaid. While Medicare is not a means-based program, there are multiple issues with it because the AMA allowed physicians to charge maximum rates in the past for those beneficiaries. It also does not help with chronic conditions since it only supports 60 days in hospital. Elders had to deplete their savings and everything they worked for to qualify for Medicaid because Medicaid is geared towards long-term care facilities, mandating that they provide long-term care benefits better for chronic disease sufferers. Medicare is still lacking. They only cover 100 days of home health care right now, and that 60-day hospital has not increased. A policy solution on the rise is the Elizabeth Dole Home Care Act, supported by the VA and the National PACE Association, along with others. They support service, importance of human relationships, and competence, while encouraging the importance of caregivers. The Secretary of Veteran Affairs will select 10 areas that lack resources and give resources to veteran elders. This includes community resources, furnishing, and amazing care staff who are expertly trained in the area of elderly veterans. Consideration I saw was that there is a 3-year trial period of all this occurring and then a 1 year of review. However, I believe services will be cut off at that point for the review period. Instead, they need to have a 1.5 year review period, combine that data with the 3-year period, and just have more data overall while allowing the elder to keep that service. Current policy in action that is very beneficial is the Older Americans Act, which created the Administration on Aging. This allows for empowerment on all aspects of elder autonomy and living in place. OA programs help with nutrition, education, employment, research, overall advocacy, etc. One barrier to the OAA is the LGBTQIA history. They did not adequately assist this program in the past, with only 1% identifying as such in the previous data set. Biden just created a program to address this, and it looks very promising, but there is lacking of data, of course. We need to make sure that conservative states do not skew their results, and we need to make sure that the social stigma endured by this subpopulation is adequately addressed. Policy priorities for the U.S. aging include the extreme caregiver shortage, elder autonomy, giving them chances to speak out about the issues they're facing, the Medicaid institutional bias, and increasing funds for various programs such as the Elder Justice Initiative, which helps with adult protection, and things under the OAA, such as the chronic disease self-management and the fall prevention. Again, these funds need to be increased because this is a huge issue for elders. If they fall or have a chronic disease, this does increase their chances of being institutionalized. So in conclusion, elders dream of living in place just like most of us do, but that is sadly not a reality for many, especially veterans who have given so much for this country. Regardless of the research that is shown to be beneficial for aging in place, as well as less cognitive decline, social stigma such as ageism rejects this, and they do not allow for that. The OAA and the Elizabeth Dole Home Care Act acknowledges this, and hopefully more actions will be taken for the justice of the elders. These are resources to click on if you want to explore the benefits that they can have. Again, we need to, as a society, address the justice that is needed for the veteran elders. They supported our justice, so we need to support theirs.